Wonderful. I'm blown away. Like, I can't keep up with all the good things that are happening. Every time I hear people speaking, I'm like, oh, there's another good thing that's happening, and there's another good thing that's happening. So it's just great. And I mean, I'm really looking forward to just having a condensed way of presenting that and having a report there that we can point to, because it really, I think, reflects all of the amazing things that are happening. I'm just want to spend a bit of time now thinking, well, what does this mean for us and what does it mean for you? And what I'm going to ask you to do is to think about, in your role, whatever that is. I know we've heard a lot from implementation leads, and I know not everybody has them. But when this model started in Edinburgh, we didn't have a lead like that. It was all very new. Is that actually there's all things that we can be doing to create more domestic abuse informed systems. So we can all be leaders in this, and we can help with the implementation. We can help within enabling contexts. So again, this slide, innovations, implementation, and context is what creates socially significant outcomes. So what can we do in our role to support the work that people are doing to implement Safe and Together, even if maybe we're not a champion, or we're not a lead, or we've maybe just attended the training? What ways can we support to create enabling context and effective implementation? So thinking broadly about what leadership means and who the leaders are, that might be national leaders who are involved in Scottish Government, or delivering equally safe strategic boards, or anything else, but that actually we also have local leadership who can be influenced and spoken to. I think it was Mike who was talking about supervisors and managers and the importance of the role that they have in leading change with the practitioners that they supervise and manage, as well as the champions, the mentors, the people who are subject matter experts, the people who are saying, this is something I know about, and this is what I think we need to do. What we've found across the board is that people manage up with Safe and Together. So people who have gone on core training begin to tell their leaders in their organisations and their supervisors what they know domestic abuse informed practice is. I mean, we've talked about the lack of training there is in this area. So people who have gone to 4 days of training know much more than a lot of the people that they're being supervised by, or a lot of the people who are in leadership positions. And what we find is that it gives them a language and a way of speaking about the issue, without being maybe angry or divisive, that brings people together and allows them to make those changes with people who are above them. And often we see people who are champions in the model be promoted in their organisations. Actually, we have a lot of evidence of those people moving forward because the model makes you think systemically. And even Mike's feedback there around what happened in the training is that people start saying, well, what about this system? But what about this process? But what about this organisation? And that's because the model in itself, I think, creates systems change and allows people to think in a systemic way that is really helpful for this kind of leadership and influence. And the implementation leads that are there doing that work is wonderful. But if you think about what Anne Trevorrow, I know she's left just now, but what she was saying, that in meetings she said, I don't see Safe and Together in this documentation, and where are the protective efforts? We can ask questions in whatever role we're in that are domestic abuse informed and help us create domestic abuse informed systems. Asking, what do you mean by domestic abuse? I'm not sure. Could you talk to me about what the behaviours are? What did the perpetrator do? Is a way to do that. Asking, could you talk to me about protective efforts, is a way to do that. And actually, the more that we create that environment where people ask these questions and say these things, and that becomes the way that is normal for people to function, it becomes much harder for people to use failure to protect narratives. It becomes actually what was happening with Anne, was people were saying, I know what you're going to say. And if you're in a supervisor and manager position and you've got staff who know what you're going to say when they come to supervision, they do the work. They do it without having to come there first. And that's how practice changes, and that's how systems change. So you can be a leader in whatever role that you're in. And we are going to spend some time in small groups talking about what you can do to really create domestic abuse informed change and how you can lead that in your organisation. So just some thoughts for those discussions. What policy and practice changes are needed, and I will I don't know if Julie Stewart and Katrina McCain are here. I think Julie Stewart is, so maybe Julie, I don't know if you want to in a minute, once I finish this, talk about the policy change in housing that there's been. So the housing, Scottish Government's been involved in work to change housing policy to be much more perpetrator focused, engaged in focusing on rehoming and rehousing perpetrators or asking them to leave. So that's an example of a policy change that's domestic abuse informed. So this isn't just about training. Who will lead the implementation? What's the business case for the changes? And, you know, we've talked about costs. What is it that people need to know around how much it costs to remove children and how much it costs for them to be away from home for the length of period that they are, and how heavily that correlates with domestic abuse? Do we have that information to give to people who might be making decisions about funding and resources? How can they integrate and support other priorities and initiatives? What is it that our other public protection areas are doing that we can link in with? How does it support the drug and alcohol services? How does it support the different policy shifts that are happening? And can we align with those? How do leadership communicate their commitment to domestic abuse informed principles? So, you know, what does it mean for a leader to say, we believe that perpetrators are responsible for the impact of domestic abuse on the child and we want to partner with survivors? What does it mean for a chief social work officer, for example, to say that? What does it mean for the families and survivors who hear that to know this is how my local authority views this issue? So communicating this shift is really important and can be a big part of leading and changing. Again, supporting staff at all levels across different departments to give them skills, not about awareness raising. What do they do differently? Can we link the work that they're doing to actions that help them become more domestic abuse informed? And then really thinking about data collection, human resources and service delivery models. What does it mean when we say that, for example, the services that our local authority funds are being asked to be domestic abuse informed? So we know that reports and things being returned asking, we want this to be domestic abuse informed. Similarly, do we ask the services that we work with, could you tell me more about the perpetrator's pattern? Or how does your, for example, substance use service help me with my goal of his role as a father, for example? So in our referrals with each other, in our work with each other, how can we make sure we're being perpetrator pattern based and focusing on survivors' protective efforts and being child-centred? So really thinking about influence. There's a really good, I think it's Stephen Covey that's done circles of influence and circles of concern. And if your circle of concern is smaller than your circle, is larger than your circle of influence, then you start to feel uncomfortable. If you feel like you're worried about things that you don't have the ability to influence, it can feel really difficult. And so understanding, even when you're not in maybe a local authority leadership position, what can you do to use their power and authority to help create domestic abuse informed systems? So who are the people that you need to engage with? Who are your allies? What's the best way to engage with them? And often that's about giving them a way that Safe and Together answers a problem they already have. So we know that people are concerned about things like children being accommodated. We know people are concerned about domestic abuse and survivors. But do they know that we can also think about how costly that is? Do they know that actually this can help with things like staff retention and workers feeling more confident in their jobs and less burnout? Anything that we can evidence and say to leadership that helps them understand maybe a problem that they don't even know that they have. So thinking a lot about what the pain points are of the people that you're talking to and the audience that you're trying to engage, and how they the Safe and Together model and domestic abuse informed practice helps them with their solutions. So bridging that gap between different people's priority areas and thinking about how we can all work together to meet them. So we're going to spend some time in, and I put some information just quickly about this in the chat about our conference and the mapping tool and things, and we're going to, if I'm tweeting now, so if you want to tweet with me, then great. But I do just want to give time to the talk about the housing policy if somebody wants to jump in about that. I don't know if they do. I spoke to them a wee while about it. Nope. So Joe, I'll hand back to you.